Good afternoon, my name is Ângela, and I'm here to present IR Bactyping, which intends to solve one of the most relevant public health problems nowadays. Healthcare-associated infections, which are infections that are acquired during hospitalization and for which the hospitals are morally and economically responsible for. Current estimates are that 1 in each 10 hospitalized patients per year are infected during hospital stays, and from these, many of them die as a result of healthcare complications. But the biggest problem is that with increasing frequency, these infections are caused by antibiotic-resistant bacteria, and especially by those 6 species that have been recognized by the World Health Organization as the most critical to tackle. They cause infections that kill more, that increase the length of stay, and that represent high economic costs for hospitals. So to help you understand how hospitals deal with infections, let me give you an example. In this hospital, several patients are infected with E. coli. Whenever hospitals suspect of an abnormal number of cases, they need to implement infection control measures such as to isolate the patients, to prevent further infections, and to disinfect the area. But to know that this is E. coli is not enough, because within E. coli there are several types, and some of them may be more pathogenic or antibiotic resistant or persistent, or can spread easily between patients, healthcare professionals, or surfaces. Identifying each of these specific types, hospitals are able to group similar cases and to apply specific infection control measures to prevent further infections and also to improve patient care. Thus, it is easy to understand that the sooner and effective these measures are, the better. But the big question is, why hospitals do not do it now? Because the only current solutions available are based on time-consuming and costly DNA analysis. For you to have an idea, in the best option, it takes 4 days to have a result, which can be too late because the bacteria are already spreading. This problem has been recognized not only in Portugal, but worldwide, by different key opinion leaders with whom we talked to. And we have the solution for this problem, because with IR Bactyping, we have found a way to perform bacterial typing without DNA analysis. We can do this because we use infrared spectroscopy to establish spectrum profiles and with this identify bacterial types. Well, how? We knew that each bacteria has a specific spectral profile. What we did is that we figured it out which portion of the spectra is the best differentiating types and why. And we maximize those differences using mathematical models. And with that, we created a data warehouse that we use to predict the type of a new sample. We did this already for 3 species, and we can do it for many others. With this, we set up a service to offer to hospitals that was thought to reduce hospital workload, to save time and costs, and to allow routine testing. It is simple. The hospitals send us the sample, the bacteria, we cultivate it, and we perform the spectral analysis. We are able to tell the results in 48 hours or less. That corresponds to half the time of the best DNA-based reference method. Also, we have the lowest cost as a response to customer needs. Besides, we are the easiest to implement, and hospitals do not need to invest in specialized resources. Thus, we have the best combination of features, and we are not alone. Bruker, one of the larger manufacturers of infrared equipment, have recently launched a product that intends to differentiate bacteria using infrared spectroscopy. But because they do not have databases or models to support, they cannot identify bacterial types. And that's why they are interested to incorporate our solution into their product. So, what can we do for hospitals? With our solution, hospitals can have a more targeted infection control that will reduce the number of infections by around 25% and also can reduce hospital stays and costs associated. And also very important, they can improve patients' outcome. And we know that this works because we have already tested our product in 5 different hospitals since 2015 to solve specific problems. And we are now currently setting up a pilot study with a hospital nearby. And we also know that our market is big, and it is increasing. We consider our total market to be the total number of bacterial infections worldwide. But from those, we want to address only those caused by those 6 most relevant species that have been recognized by the World Health Organization in Europe, USA, and Japan, because comprise 80% of the market. Our target, antibiotic-resistant bacteria, worth almost 400 million euros. And to get into this market, we will, in the first year, set the startup and the necessary accreditations. We will perform a validation study with 4 different European countries on our first product, on Klebsiella pneumoniae, to validate our solution. And we are able to sell. Meanwhile, we are going to prepare other products for the other 5 bacterial species. And as soon as each product is available, we are able to sell. For this, we need a total investment of 660,000 euros that will help us to enter into market in the first year, first in Europe, then in the US and Japan. And we expect to have a payback in 3 years and a total revenue of 21 million euros by 2025. To get this through, we are a highly committed team composed of 3 researchers with more than 30 years of experience in bacterial typing, supported by our mentors for business and entrepreneurial guidance. We have also partnerships with hospitals that we use to validate our solution. As a key message, remember, healthcare-associated infections are a big problem, and we have the solution to save time and cost to deal with it, and with this, break the chain of infection. Thank you very much for your attention.